This video is about releasing chest pain. Chest pain is caused from the obvious, the pectoralis muscles, but it's also caused by the diaphragm and by the scalenus muscles, the muscles that attach to the top and the bottom of the chest and the rib cage. So when those muscles are tight, they can distort and twist the chest, and they might need to be released in order to release chest pain. So let me show you all the muscles from the scalenus all the way through the pectoralis. Okay, let's look at another group of muscles that are connected to the throat, more connected to the neck actually. They're called the scalenus muscles. The scalenus muscles are the breathing muscles in the neck, that is. So what the scalenus muscles do is the scalenus muscles lift the first rib. The scalenus anterior lifts the first rib. The scalenus medius also does, and the scalenus posterior, as I'll show you in a second, lifts the second rib. But these are involved with breathing. So of course, singers, they can strain these muscles really easily from singing a lot. And if they get strained, it's going to make it a lot harder for them to sing, because the scalenus muscles actually push on the phrenic nerve, which is the main nerve that goes to the diaphragm and actually to the scalenus muscles themselves. So when the scalenus muscles are tight, they'll pinch that phrenic nerve, and it causes trouble with breathing, and causes it just makes it almost impossible for a singer to really perform. One of the important things when you're doing this technique is to be careful of how you're touching the ear. She actually has an earring on, and I'm making pressure with her ear, or with the hand that's cradling her head, and I can see her neck is starting to tense up a little bit. So I'm actually going to have to adjust my pressure, even though I'm trying to build pressure onto the scalenus. This is not going to work. So give me a second. I got to adjust my hand. Okay, well, but I mean, the technique is good. You can kind of get the idea. I'm slowly increasing the pressure on the scalenus while I'm holding the stretch at the same time, and then starting to back my pressure out very slowly over about a minute, making it feel like my pressure is backing out and not going anywhere. Okay, yeah, we're definitely gonna have to take pressure or reset my hand. So there we go. How's that? Sorry about that, Lisa. We're getting back into the scalenus anterior now. I'll take it actually just to the outside of the sternocleidomastoid muscle. You can get to it from the inside or the outside. But yeah, this looks like it's working a little bit better. So hold the pressure. Slowly increase your pressure. So a lot of times you actually have to ask them to look to the right, because they're not quite understanding that they need to go as far to the right as they can. You're taking all the slack out of the scalenus in order to feel the release, right? You have to feel that it's stretched all the way and that they're trying to relax. And then when you trigger release, you'll feel it melt under your fingertips, and they'll be able to go all the way to where their cheek is touching the table or touching the sheet. So let's try the other side. The scalenus, like any muscle attached to the vertebra, you definitely have to make sure that you release the scalenus on both sides. Because if you don't, you're going to cause a headache, a really bad headache, because it'll be tight on one side and not tight on the other. And the vertebrae are going to get rolled out of place. So, okay, so carefully cradle the head with one hand, and then slide in there. Feel, that you're definitely on muscle fibers on the scalenus anterior, which means you have to sense, where the gaps are, the channels are on the left and the right, which contain the carotid artery and the jugular vein and the vagus nerve and the phrenic nerve and the brachial plexus. So be careful of all those things. Be on the muscle fibers. Slowly increasing your pressure, slowly increasing the rotation, but it's also very careful. And then slowly back your pressure out, making it feel like you're backing out even though you don't go anywhere. See if you can trigger a release. And once you do, boom, it'll see her head's rotating all the way to where her cheek is touching the table. There we go. Okay, job accomplished. Let's go on to the scalenus medius now. The scalenus medius is, it attaches more to the outside of the first rib instead of to the right in the front. But the mechanics are almost the same as the scalenus anterior. So go ahead and watch. It's just a little bit further to the outside, but it's the same idea. So ask them to turn their head all the way on their own, and take the slack out. Increase your pressure. Make sure you're on fibers. Make sure you're not on anything else other than muscle fibers. You'll be okay if you do so. And after increasing your pressure for a minute, see if it'll start to melt, start to back your pressure out. Make it feel like you're backing out, even though you don't go anywhere, for up to 60 seconds, maybe even 2 minutes, and see if you can trigger that sense of it melting on the way out. If you do, their cheek will be able to touch the table. And that actually, these two together will release the phrenic nerve. And the phrenic nerve is the nerve that goes to the lungs and the diaphragm. Sound familiar for breathing? Those are pretty important to keep released off of that phrenic nerve, because you need that phrenic nerve to be freed up in order to breathe. In fact, in order to breathe at all. And you want to keep the vagus nerve freed up too, because it keeps the heart going, and make sure that you don't have acid reflux or anything like that, because that controls, the vagus nerve controls the stomach and the heart, and that travels right under where you're pressing also. So another reason to be sure that you're on muscle tissue. The scalenus posterior actually goes down to the second rib, and it goes down to the second rib in a little bit to the back, right? So before, I was rotating the head the other way. The scalenus posterior rotates in the opposite direction from the scalenus anterior and scalenus medius. So to release it, you actually have to turn the head away from it, turn the vertebrae away from it, while you're holding the pressure. Build up your pressure until you feel like it might melt, and then slowly back your pressure out, triggering the release, making it feel like you're backing out, even though you hold a good firm pressure for up to a minute or two. There we go. Looks like it's letting go. Oh yeah, her head's going all the way. See, and I had to do the scalenus anterior and the scalenus medius on the left side first in order for her to turn her head that far. Now I'm going to have to do it on the other side. Okay, I'll let you just watch for this one. If you'll notice when someone breathes that they lift their chest up, like they breathe up into their chest, it means they're a chest breather and they're not using their diaphragm. If you use your scalenus instead of your diaphragm to breathe, you're going to strain the scalenus muscles. So this is usually the cause. You can usually actually see it. If they were to put a hand on the belly and a hand on their chest, only their belly should come up when they inhale. To release it, you actually have to turn the head away from it, turn the vertebrae away from it, while you're holding the pressure. Build up your pressure until you feel like it might melt, and then slowly back your pressure out, triggering the release, making it feel like you're backing out, even though you hold a good firm pressure for up to a minute or two. There we go. Looks like it's letting go. Oh yeah, her head's going all the way. See, and I had to do the scalenus anterior and the scalenus medius on the left side first in order for her to turn her head that far. The way you can tell you're on the scalenus posterior instead of the levator scapulae is the scalenus posterior obviously goes to the second rib instead of the scapula. So with your thumb down there that's feeling around trying to do a pressure point, make sure that you're pressing on the first rib. You'll be able to feel the scapula beneath that and trace that levator scapulae if you wanted to. But just be sure you're on the scalenus posterior because it goes to the second rib. So you may wonder, what does the diaphragm have to do with chest pain? Well, the diaphragm, it sits right behind the sixth rib and comes across the middle of the thorax, as you can see in this picture here. And when it's tight, when it contracts, it expands the lungs and helps us breathe. And it puts pressure when we breathe on the actual ribs and on the inside of the chest. So that is the way that it can cause chest pain, by pulling on the bottom of the ribs and distorting the chest, which can give the sternum a twist or a compression. And sometimes you have to release it to release chest pain. Also, the aorta passes through the diaphragm, and the heart sits on top of the diaphragm. So if the diaphragm's tight, if the diaphragm's tight, it just makes it rigid around the heart. Just kind of makes it hard, I think, for the heart and the pericardium to function normally, and that'll give you just sort of an ache or a pain, I think, just because it's making it actually difficult for the heart when the diaphragm's tight. So we got to release it to release the chest and chest pain. So let's look now at the direct muscle directly over the chest. Right here we have the pectoralis major. The pectoralis major is the pec, the big pec that when you do push-ups, that's the pec major. This is the pec minor. The pec minor attaches to 3 vertebrae, the 3rd, 4th, and 5th vertebra, or not vertebra, but ribs. And on the other side, it attaches to the coracoid process, which is part of the scapula, the shoulder blade bone, but it attaches to the front. And when it contracts, it brings that scapula down and forward, like when you're doing bench press, I guess, but it doesn't move the actual humerus. So now let's show you the pectoralis major. This is the big pec. This is the one that comes all the way from the sternum over to the humerus bone. And this is the one we use when we're doing like a bench press and or a push-up. So this is a way to get into it. The pectoralis major, what it does is it adducts the humerus bones, which means it brings them towards each other across the front of the body, the anterior adduction, and this stretches it. See, so I'm stretching it, increasing my pressure into the point, and then slowly backing my pressure out to try to trigger the release. I'm trying it with my thumb and my index finger. Now my thumb is going into the insertion deep part of the pectoralis major. The pectoralis major twists just before it attaches to the humerus bone, and I'm hooking in under that under the pectoralis major into the underside of it to try to release the insertion side where it twists. So I'm just kind of gathering with my index fingers or with my fingers over the front of the muscle, but the thumb is actually doing all the work. Just following that twist and doing releases. So I'm just holding the pressure, slowly backing my pressure out, and waiting for the release. And I feel the range of motion open up more and more in the pec major as I'm doing it. So the pectoralis major is such an important muscle. The twist really gives it a lot of extra power, because you know, when you twist fibers, it just creates a lot more strength than just straight pulling. So sorry about the video here. I'm trying to keep it together. Let me show a little bit more in the range where the humerus is up a little bit more. So with this, you just really have to be persistent. Find those tight fibers. Make sure you're really pressing into the tightest points and the tightest fibers of the pectoralis major, and just waiting for the release. And then make sure you really get releases in it. And if you do, it'll release pain that goes, you know, that requires right around the attachments of the pectoralis major. It attaches, like I said, over to the sternum, right on the front of the chest. So pain in that area can really drop down quite a bit when you get the pectoralis major to let go. And there are other causes of chest pain too. If someone has a lot of chest pain, you know, refer them to a doctor in case it's their heart or something like that. But releasing all these muscles actually really helps. Give it a shot, and I'll catch you on the next video.